The American healthcare system is on an unsustainable path. The increasing regulatory intrusion into health insurance has doubled down on the wrong incentives.
Concerned about healthcare access, cost, quality, and the uncertain future of patient protection.
People are angry. We promised them change in Washington.
It has now been nearly a century since Theodore Roosevelt first called for healthcare reform.
Healthcare spending is rising around the world. The U.S. healthcare system is not as effective when it comes to controlling costs compared to systems in other countries.
Our collective failure to meet this challenge, year after year, decade after decade, has led us to the breaking point.
Healthcare reforms have had drastic changes in the United States. This was first influenced by progressivism, leading to the initiation of efforts to achieve universal coverage. In 1912, Republican President Teddy Roosevelt endorsed health insurance, and the first law for regulating health insurance began that year. And in the early 1930s, Democratic President Franklin Roosevelt proposed a publicly funded healthcare program. This trend of healthcare reforms continued through almost every president elected since the early 20th century.
Overall, our healthcare is good. I mean, we have a lot of room, but we have some of the leading in technology, although some of the outcomes are not always that great. And there's some issues that go on to the way that we live as Americans. We've got to continue to reduce, I think, rates of smoking and other kinds of habits that actually can cause problems with healthcare.
It's really unfortunate in America that we have such high healthcare costs. But I would also say that we are probably one of the nations that don't take care of themselves. So I think getting back to the basics of learning how to take care of ourselves and not eating so much processed foods and going forward from there would be a huge asset.
America is a welfare state in which Medicare and Medicaid are forms of government health care provided to the people who meet the qualifications. What if you don't meet these qualifications? The majority of Americans pay for their insurance, but the rates and deductibles continue to rise. Practical care such as dental and eye care usually are even more expensive add-ons. So where do we go from here? What reforms are necessary to help the majority of our citizens in this inflated economy in which wages aren't keeping up with?
I think one of our challenges is the fact that you've got to create, I think, more ownership for healthcare outcomes and more accountability for the patients, and put the patient in the middle of that discussion between the doctor and the patient.
People can argue the point saying that healthcare is a constitutional right. Some will say it's not. We can argue Social Security a right, is it not? How do we deal with people that don't have healthcare or healthcare insurance? I would have to say, let's follow the money. The love of money is the root of all evil, and is Big Pharma behind some of those healthcare costs, and figuring out how come I can pay this amount for insulin from this resource, but then this resource has insulin so much cheaper. I think that's probably going to the root cause.
I strongly believe that Congress needs to engage in strong oversight to help maintain the public's confidence in the FDA. Changes to the drug safety system should be carefully considered to ensure they do not unduly impact patient access to important therapeutics.
You have industries like the pharmaceutical industries, which charge an exorbitant amount for their medications, where if they charge a more reasonable and fair amount, fair to the patient, fair to the company, those costs could be reduced significantly.
President Teddy Roosevelt once said in his 1912 speech on health reforms, "We hold that the public has a right to complete knowledge of the facts of work." On the basis of these facts, and with the recent discoveries of physicians and neurologists, engineers and economists, the public formulate minimum occupational standards below which, demonstrably, work can be prosecuted only at a human deficit. In the third place, we hold that all industrial conditions which fall below such standards should come within the scope of governmental action and control in the same way that subnormal sanitary conditions are subject to public regulation, and for the same reason, because they threaten the general welfare.
These healthcare professionals are doing heroic work each and every day to save the lives of America's children. But they're being forced to fight through a system that works better for drug companies and insurance companies than for the American people that all these wonderful health professionals entered their profession to serve.
After extensive research, we have found that healthcare reforms will never be perfect for everyone or be able to help everyone, but will always have an effect one way or another.
Yet more than 3 in 5 Medicare recipients now lack dependable drug coverage, which can lengthen and enrich their lives.
In conclusion, we found out that healthcare is changing all the time and is unfair to people with pre-existing diseases and disabilities.